Hello there and welcome to the clinic where we're going to be looking inside your eyes today with a new piece of ocular equipment. But first I want to introduce the latest addition to the clinic. This is my new FlexiSpot E7 Pro standing desk. And with a simple press of the button I can spend more time standing up rather than sitting down. So as a medical professional, that makes my back much more happier. So as I said, as you're looking here, this is the E7 Pro standing desk in a walnut finish. There are a range of wonderful finishes available on the website. I'm going to leave the link in the description to FlexiSpot, where in April you can enjoy up to 30% off your purchase. But I've been very happy with this. It's made life much more easier when operating in the clinic. See, we have better access to the equipment. And as you can see here, it comes with an inbuilt USB port for charging your phone or my ocular equipment. So please check out FlexiSpot using the link in the description, and thank you. Okay, so let's have a brief look at the equipment we're going to be using today. Okay, so this charging up here in the USB port is the indirect binocular ophthalmoscope. It is fully head mounted. We have the adjustable dials here for optimum practitioner fitting. This is the front part. Let's remove the cap here. Okay, we have the viewing portals here, which are adjustable depending on the practitioner's pupillary distance. You want to be achieving a binocular view. Okay, and if we flip it on, so there is our green light source. You'll be pleased to know there are 3 settings here. So we have our red free, we have our white light, and we have our cobalt blue apertures there. We can also adjust the aperture size, large, medium and small here. So let's have a look at that. So we have the largest, medium and small there. And we also have an intensity dial here for optimum comfort for the patient. If we give that a little turn, we can adjust the brightness there. So that's what we're going to be using to look in the back of your eyes today. Head mounted indirect binocular ophthalmoscope. And just moving on, we will need to use a particular lens for looking at the back of the eye. I'll obviously hold this in front of the eye. This is the 20 diopter double aspheric lens, housed in this protective case here. So that is the lens we shall use to observe your fundus. Okay, very simple to use. And as with any medical tests, we shall have to record the findings. Let's go a little bit higher here. This is the fundus chart recording pad. So you can place your details here and the date, whether we're looking at the right eye or the left eye. This is where we shall record our findings. We can obviously apply some written notes here if needed. And we shall record the results like this, because when using the indirect ophthalmoscope, the image is upside down and inverted. And this will be how things actually look inside your right or your left eye. That's the recording pad for today. Now, to achieve the best possible view at the back of your eyes, we're going to need some eye drops. So we're going to be blurring your vision, dilating the pupils. We shall use some tropicamide, 1%, 1 drop in each eye. And to aid dilation, we'll also be using another minim. This is phenylephrine hydrochloride, 1 drop in each eye, 2.5%. Okay, so that's all the equipment we're going to be using today. And we may pop some fluorescein dye in the eyes as well, just to check for any ocular staining. Okay, so now that you're ready, we're going to be instilling your eye drop. Remember, we have 2 types of drop to dilate the pupils. We have the tropicamide. Okay, it does sting for a few seconds, but it will ease off. Okay, it may be blurry for up to 4 to 6 hours once you leave. Okay, so if you're ready, looking up for me, let's place 1 drop tropicamide in the right. I'll give that a moment. Okay, try and look up again. We'll pop a drop in the left eye there. Okay, I'm just going to prepare the phenylephrine drops. Okay, when you're ready, looking up again, 1 drop in the right eye. Okay, looking up again, 1 drop in the other eye. Okay, the stinging will ease off very quickly. Now what we do need to do is we need to wait in the reception area for about 20 minutes for the full effect of the drops to take place. So go and have a seat in the waiting area. I'll come and check on you shortly to see if the drops are working, and then I'll call you through. Hello there and welcome back to the clinic. So I'm going to set up the indirect ophthalmoscope now to have a look at the fundus of the eye. So just bear with me. So we want a nice secure fitting to ensure that we have a nice binocular view there. We want this to be sitting at the correct orientation. Okay, let's have a look at adjusting to the white light and the biggest aperture to begin with, now that your pupils have dilated. Let's have a little look at the brightness setting here. Okay. I don't want it too bright, I need to remain comfortable. So let's go about halfway there. That's looking good. We should be able to achieve a nice view there. we have the recording pad here. Let's pop your details in. Today's date. And we're starting off with the right eye. Turn the image recording sheet upside down to that. Okay, now if you're ready, just try and relax. Look over my right shoulder into the distance. I'm going to hold the lens just in front of the eye there. A little bit of movement in and out as we try to obtain the best focus. There we go. So I'm just observing the optic nerve head there. Lovely. We have about 0.4 cupping. The margins are nice and flat. Just moving slightly this way to observe the macula. I can see a nice bright foveal light reflex there. The macula looks flat and there's no signs of any edema or hemorrhages there. And a little bit closer, certainly no signs of any epiretinal membrane. Excellent. Just going to adjust the aperture to the medium size there. Okay, if you could look up to the ceiling now. Up and right. Directly to the right. Down and right. Down to the floor. Down and left. Over to your left side now. And up and left. Okay, just relax a second. Okay, now looking straight ahead, we're just going to come back in with the green light assessment. Just looking at the nerve fibres, better viewed with the green light. I'm just going to look at the blood vessels. Thank you. Look up. Look to the left. To the right. Just down to the floor. Lovely. Okay, so just record those results down for the right eye. No signs of any birthmarks or nevi at the back of the eyes. Fundus was completely clear. Optic nerve head fine. Okay. Let's move on to the left eye now. Okay, just looking over my left shoulder. Best you can. Obtain the correct working distance there. About there, good. And just looking at the optic nerve of the left. 0.4 cupping approximately. No signs of any notching. No disc hemorrhages. No pits. And the vessels look fine at the crossings, they're nice and distinct. And there's no elevation of the neural retinal rim. Normal looking lamina cribrosa there. But okay, just looking up again. To your right. sorry, up and right, and down and right, down to the floor, and down and left, directly left, up and left. There we go. Okay, just relax again. Just back in with the green light, looking straight again. Normal looking retinal nerve fibres there. Vessels 3 to 4. No signs of any AV nipping. Okay, looking up again. Right. Left. Down to the floor. Excellent looking fundus there. Okay, so let's record those results for you. I'll make some written notes as well. This will be stored in your records. Now we did say we were going to pop a little bit of orange dye into the eyes just to check the anterior ocular surfaces. So I have the dye here, slightly yellow. Okay, looking up to the ceiling, please. One drop in the right and one drop in the left. Just relax. I'm going to set up the blue light now. Okay, we need to switch to maximum brightness next. There we go. Maximum brightness, no lens required this time. I'm going to come very close and I'm going to check the corneal staining there, or absence of. Lovely. And looking up, looking at the inferior conjunctiva. Now to the right and left for the temporal conjunctiva. Good. And looking down. That's looking grand. And for the left eye now, looking over my left shoulder again. Okay. Maybe a little bit of punctate staining in the superior zone of the left cornea. Okay, looking to the right, looking to the left, and up and down to the floor. Looking great on the conjunctiva, just some normal looking ripple staining, no more than grade 1 there. Just look straight again. Let's recheck the left cornea. Excellent. So this concludes the ocular evaluation today. Just make a note of the corneal findings there. So right eye now staining, left superior corneal zone, superficial punctate by the look of things. So that is everything. Thank you for coming into the clinic today, and I'll see you again next time.